एवरीवन वेलकम बैक टू माय यूट्यूब चैनल। आज की वीडियो में हम देखेंगे गाइड फॉर द एविडेंस बेस्ड प्रैक्टिस ऑफ द कार्डियोपल्मो एक्सरसाइज फिजियोलॉजी, या फिर हम कह सकते हैं इसको फिजिकल थेरेपी। तो हम चलते हैं वीडियो की तरफ। द प्रैक्टिस ऑफ द फिजिकल थेरेपी इज ग्राउंडेड इन द मीटिंग the needs of the individual patient by optimizing their overall health as considered with the World Health Organization definition of the health. Physical therapists attempt to achieve for their patient not only the absence of infirmity and disease but also a state of the physical, mental and social well-being. Thus, in addressing the health of their patient, physical therapists consider not only the physiological and biological wellness but also acknowledge the importance the variables of the functional status and quality of life. The foundation for evaluation of the patient with the cardiopulmonary dysfunction is based on the collection of the subjective and objective data to provide a diagnosis and prognosis, guide evidence-based intervention, and produce measurable and optimal outcomes. This data primarily collected at the initial evaluation and readdressed at the point along the course of the care, consistently including a chart review to evaluate the biological measures such as lab values and to gather medical history and system review that allow for the gathering of the data on the functional measures such as pain, range of the motion, strength, manual muscle testing, functional mobility. In addition, the collection of the physiological measures such as the blood pressure, heart rate, respiratory rate, oxygen saturation, ankle brachial index, lung and the heart sound, and rate of the perceived exertion (RPE) walk scale is essential to provide safe and appropriate intervention and quantifying the outcomes, because the outcome of the optimal health is not tied solely to any one of these variables. A comprehensive collection of the information is necessary to guide and optimize the appropriate care. In addition to biological function and physiological data collected at initial evaluation, health-related quality of the life (HRQL) must also be considered as a data. This is essential to gather during the initial evaluation and re-evaluation of the patient. HRQL is a measure of the how biological and then influences a function, general health perception and quality of life. Anxiety, depression, perceived disease burden, general health perception. Thus, HRQL comprises physical, mental, social, and the role of the functioning is a method for assessing the impact of the disease on the life of the patient. Patients with the cardiovascular and pulmonary dysfunction are at high risk for the decreased exercise capacity, impaired physiological response to exercise, poorer quality of the life, and the higher rates of anxiety and depression. For example, dyspnea and angina are associated with the both impaired physical and psychological functioning. In the patient undergoing precautions, coronary intervention, quality of the life was found to be decreased 3 months following the intervention. Couch and Associate evaluate 6,305 patients who underwent coronary artery bypass graft and found a significant association between poor postoperative HRQL during the recovery from cardiac surgery and reduced the long-term survival. As Verdo and the colleague evaluated 424 adults with heart failure and found that the quality of the life score significantly lower as the heart failure stages progressed. Finally, depression and anxiety are not only linked to the cardiac surgery and coronary artery disease but also predict less compliance during the phase 2 cardiac rehabilitation. Rehabilitation and the exercise, however, have been linked with the improvement in the exercise capacity, physiological response to the exercise, quality of the life, and decreased symptom of anxiety and depression among the patient with the various form of cardiovascular and pulmonary dysfunction. Tenderness and associate found improved functional performance and quality of life in the cohort of the individual with the chronic obstructive pulmonary disease who underwent a pulmonary rehabilitation program. Smart and Associate evaluate 51 patients with systolic and diastolic dysfunction and found that the exercise training was associated with the improved quality of life in the both populations. In addition, exercise training has been found to improve the quality of life, symptom, increase physical functioning and life efficacy for the exercise, and in the individual with the coronary artery disease and heart failure. Home-based exercise has been shown to improve the quality of the life and functional capacity in the woman with the heart failure. If you have any query, you can ask me in the comment section. Thank you.